Hi, we are the THIAZIDE Diuretics. So before I tell you our drug name, I will first describe what we are. We, the thiazide diuretics, are also called water pills. We are an FDA-approved class of drugs that block the reabsorption in the distal convoluted tubule of the nephron of 3% to 5% of luminal sodium. Thus, we facilitate the production of natriuresis and diuretics. We are also approved for clinical use in the management of primary hypertension. In order to significantly improve the clinical response in highly hypertensive patients, physicians use us as agents either as a primary therapy modality or in combination with other antihypertensive medications.
Additionally, some thiazide diuretics are FDA approved for therapeutic use in adjunctive treatment for chronic heart failure-related edema, hepatic cirrhosis, corticosteroids, and hormone therapy. Edema caused by different types of renal diseases such as nephrotic syndrome, acute glomerulonephritis, and chronic renal failure are also controlled by these agents.
So for the drug name, our generic names are benzoflumethiazide, chlorothiazide, and hydrochlorothiazide. Our brand names are Naturatin, Diuryl, and Hydrodiuryl. And this is our chemical name.
My therapeutic drug classification is that I am an antihypertensive agent, and for pharmacology is that I am a thiazide diuretic.
They are categorized as FDA pregnancy category C. Studies with animal reproduction have not been carried out, and in human pregnancy, there is also no facilitated data. However, an elevated risk of congenital abnormalities associated with thiazide diuretics has been shown in several retrospective reviews.
For mechanism of action is inhibition of the active reabsorption of chloride through the sodium chloride cotransporter in the early distal tubule, leading to increased excretion of sodium chloride. Water follows such ions and ultimately causing a decrease in the amount of efficient extracellular fluid that presumably underlies the antihypertensive effects of thiazides. The antihypertensive function is less well known, but it can be regulated by its action on carbonic anhydrases in the smooth muscle or by its action on the calcium-activated potassium large conductance receptor also located in the smooth muscle.
For pharmacokinetics, we are generally administered orally and are completely absorbed from the GI tract. The time to peak plasma concentration is approximately 4 to 6 hours. Our distribution is highly bound to proteins in plasma. Then, we are subjected to comparatively extensive metabolism in the liver before we are excreted unchanged via urine. And lastly, majority of our drug components are excreted through non-renal processes.
My indications are for hypertension and edema associated with heart failure.
They are contraindicated for use to patients with hypersensitivity to sulfonamide-derived drugs and anuria.
The adverse effects of thiazide diuretics are attributed to the anionic imbalance generated by the initial depletion of sodium in the DCT. For the integumentary system is that I cause sulfonamide allergy. For the circulatory or cardiovascular system is that I cause hyperkalemia, hyponatremia, metabolic alkalosis, hyperglycemia, hyperlipidemia, and hypotension. And for the skeletal system is that I cause hypercalcemia Rarosymia.
There are nursing responsibilities that are considered in administering of thiazide diuretics. So before the administration, the nurse should conduct assessment, history taking, and physical examination. The nurse should evaluate the cautions and contraindications, like for example the drug reactions, deficiencies in fluids and electrolytes, and hepatorenal diseases, and defects of glucose metabolism. It is in order to avoid any unfair complications. So in the history, the nurse must ask the client if the client has thiazide sulfonamide allergy, fluid or electrolyte imbalance, liver or kidney disease, gout, diabetes mellitus, glucose tolerance abnormalities, hyperparathyroidism, manic depressive disorders such as lactation and pregnancy. For physical examination, the nurse should assess the patient's skin color, lesions, edema, including its orientation, reflexes, and muscle strength, pulses, baseline ECG, BP, orthostatic BP, perfusion, adventitious sounds, liver evaluation, bowel sounds, urinary output patterns, CBC, serum electrolytes, blood glucose, LFTs, renal function tests, serum uric acid, and urinalysis. During the administration of the drug, the nurse must educate the client on thiazide diuretics to promote compliance, determine the correct drug, assess the patient's ability to self-administer, determine the right time that the patient should receive, prepare and administer the drug with milk or food if GI upset is a problem to buffer drug effect on the stomach lining. Monitor patient response to drug through vital signs, weight, serum electrolytes, and hydration to evaluate the effectiveness of drug therapy. And lastly, document medications given through the prescribed route. After administration, the nurse must track the therapy reaction of patient, for example weight, urinary output, changes in edema, and blood pressure. Next is to monitor for adverse effects. Next is to test patient awareness of drug therapy by asking patient to name the medication, its indication, and side effects to look out. And lastly, the nurse must monitor the well-being of the patient. So there it goes. Thanks for watching!